नमस्कार. प्रुडंट मिडियाच्या हॅलो दोतोर कार्यावळीन तुमकां सगळ्यांक मना काळजासान येवकार. तुमकां येवकार दितना आज आमचे तज्ञ दोतोर आसा ते आसा डॉक्टर विकास दधीच, ऑर्थोपेडिक एंड जॉयंट रिप्लेसमेंट सर्जन फ्रॉम विक्टर हॉस्पिटल. आणि ही आयची कार्यावळ आसा बेसिकली इट इज अ पब्लीक अवेरनेस प्रोग्राम स्पेशली डिझायन्ड फॉर द प्रॉब्लेम्स अँड एक्सिडेंट्स अकरिंग इन दीस सीजन. म्हणजे पावसाच्या दिसांनी जे अपघात घडटात तांचे विशीं लोकांक जागृतकाय जावची, तांचे विशीं लोकांक माहिती मेळची म्हणून आयची खाशेली कार्यावळ आमी तुमचे कडेन सादर करतात. आनी म्हजे वर आसा डॉक्टर विकास दधीच. डॉक्टर, वेलकम अँड नमस्कार. Basically, when we talk about this rainy season, it is a everybody is prone, equally prone. Like, see, you may be driving safely, but somebody may come and bang you. You may be walking safely, but you can still fall in the ditch. So all these type of things happen. So just like if you want to have a glance over the disorders which take place during this rainy season, what will be your arena of talking?
So as you have correctly said that because of the slippery roads, we see a lot of accidents occurring every day. Correct. And when someone falls down from maybe a bike or has an accident in the car or maybe fall in a ditch, the most common issues they encounter is they will have some kind of sprain in the ankle, injury to the bones leading to fractures. It can be minor or major depending upon how impactful it was. But it is very important, first of all, obviously we should all take care. Secondly, once we have the injury, it is of pertinent importance that we make sure that the patient is stabilized and is brought to the hospital emergency department, and we should start with the emergency care whichever way it is required. It can be a small injury or a big injury. Depending upon that, we might start with the medications and the treatment as soon as possible. Also at the same time, it is required that we make sure that the patient has no other medical issues along with the fractures, because sometimes if the patient has other medical issues, it becomes a challenging thing to first treat the other things than the fracture first. So yes, that is a take.
So basically at times it can be multidisciplinary because there can be some perforation to the lungs or anything in the stomach or whatever it is. So that is also possible.
Yes, so, very high speed motor vehicle accidents can have multiple injuries to the patient. Sometimes there will be involvement of the abdominal region, that is your stomach and the liver around. So we have to manage those first before we manage the actual fractures per se.
Correct. There can be some laceration or, as you said. So all these things require a prompt attention. And for your information, they have really volunteered to give this public service for the simple reason that this is a season where people are more prone for accidents. One more thing I really appreciate that the hospital is coming under Goa government's DDSY scheme. So most of the surgical procedures are at least you are getting a lot of benefit. Correct?
Definitely.
And that is good part because Goa government is spending a lot of money, and there is a lot of awareness also that it is not the prerogative only of the government institution but also of the private institutions. So we are all public partnership.
Yes, everyone has to pitch in equally.
Correct. So doctor, when we are talking about this all different type of accidents what you talked about, that also there is something called osteoarthritis.
Yes.
Okay, what are the problems which happens during osteoarthritis and how you manage with this?
Yes, so this is a very common question which people have most commonly, because most of the patients who come after an age of 60, they will have osteoarthritis, and when we see the X-ray and we tell them you have osteoarthritis, they find it a little difficult to understand what exactly it is. So just in a simple way I would like to explain it. We have bones on which we stand. Our entire body structure is depending on that. Now when two bones come together, they have some amount of oil in between, a sort of oil. This is a fluid that is, it is a sort of hydraulic
cushion
fluid.
Or lubricant.
Cushioning, yes, as we have in the hydraulic fluid in the machines. And this prevents both the bones from coming together, and this allows a smooth movement at the joint. Now, as we age, as we are above 60 years of age or maybe 70 years in some patients, because of constant use, there is a friction between these two bones. The cartilage, a smooth layer that is present, is now weared off. So they start frictioning, and this is when the pain occurs. Now, when a person develops arthritis, what can happen is they can start developing some pain. After some time, they might, or relatives might notice that there is some bowing of the leg. There is a difference in the appearance of both the legs. So this can have a very bad impact on the joints. Now, most commonly involved joints is your knee joint. That is why most of the time you will see patients having a very difficult time standing up from the low-lying chairs or sitting on sofas, or even for that matter sitting down.
Going to the washroom.
Yes. And because of the pain, they are not able to do their daily activities properly. So this is a time when we have to intervene medically and make sure that the patient is able to do their normal day-to-day activities, because with that pain it is extremely difficult for the patient to do their routine daily life activities.
So what are the common signs and symptoms at this point of time, or when they should feel that okay, now I should go for medical consultation? You know why? Because often they means okay, old age hai, thoda sa hota hai. But if you treat in time, and definitely if you intervene, as I said, that definitely it can stop the further complications. It can stop that curve, bending and lot of other acting. So you can have a peaceful and easy life.
Yes.
Correct. So what you will put as a red flag?
So, see, pain is the most important symptom that body produces for you to be aware that there is some issue with any particular bone or joint. Now, as soon as you have pain, sometimes you might take a painkiller here and there on and off, but if the pain is there for a longer period of time and if you are unable to do your daily activities properly, you should definitely go to the doctor and show. They might get an X-ray done to see if there is a developing arthritis. In the early stages, if the arthritis is just developing, there are over-the-counter painkillers. There are also medicines that can improve the cushion between the knee joint, as I mentioned earlier, stop the further deterioration of it.
Correct.
In that case, in that scenario, if we start with those medications early, if we make sure that the patient starts with physiotherapy, which strengthens your muscles in the quadriceps and the hamstring, that can give a lot of strength to the joint, and it can decrease the progress. The way it was progressing, it can decrease, or it can at least halt for some time the progression of the disease. However, most of the time we are occupied with our work and we do not give too much of importance to the health, and we might end up into a later stage in the hospital. In such a condition, we have to first assess completely. The patient has to be assessed physically, as well as the radiographs have to be done. If required, an MRI can be done to see if the ligaments are injured within the knee joint. And once we assess it, once we are sure that this is arthritis, then we can formulate a plan. Now, physiotherapy often is the first line of treatment that we start with on. We give the patient some painkillers, make sure that they are doing their regular activities pain-free. However, if the pain is still there, or if the arthritis is completely bone on bone, which cannot be treated with the physiotherapy, and if there is too much of pain, then we move towards a surgical intervention. Now, surgical intervention basically includes your total knee replacement. So what we do is, as I said, there are two bones that come together to form the joint. We take out some part of this particular bone. We take out some part of this particular bone that is diseased. We remove them off, and then we put another implant, implant on both the sides, on both the bones, and there is a cushion in between. So this makes sure that the joint moves perfectly as a normal joint should be. At the same time, the patient is pain-free, and after a period of say another 2 weeks post-surgery, the patient can actually walk as normally as they were walking before. So once the disease has progressed to that stage, then we have to make sure that this operation has to be done for the patient to lead a pain-free life.
Pain-free life. And one more important question, a word of caution, as you rightly mentioned, that sometimes people end up in going to the pharmacy and over the counter. They keep on taking the painkillers to keep on, but that is not a right advice. And best is, please don't do such thing, because some painkillers can affect your kidney and can lot of damage can occur. It can also cause gastritis. So as sir has rightly said, best is go to an orthopedician, get yourself evaluated, and let him see whether you really require surgery or physiotherapy. And because he's also not so keen. The first line of treatment, definitely, as you rightly said, physiotherapy, some exercises, some tablets can give a lot of relief. And I think that should be our first line of priority. So best is to go to orthopedician.
Yes.
Correct. Secondly, doctor, as you rightly mentioned about ligaments. What I gather, like sometimes in this season, a lot of children like to play in the rainy season, and there is a lot of fun. If you come to outside, there is a lot of people play football, and that too when it's raining. So that ligamental injury is one of the common things what I feel. So you can address this issue as a sports injury. So in this, anything you feel like adding, that also you are free to do.
So this is a very important question. We see a lot of young people who come to the OPD or emergency room with knee pain or maybe shoulder pain, and that is acute in nature because they have been playing outside, they've been playing football in the slippery ground, and then suddenly they twist their leg and they come to the emergency department. Now, one thing we need to understand is that bones, they are the mainstay of your body. But these bones have to be connected together, and to connect them firmly, there has to be ligaments that can connect both the bones together. Now, these ligaments allow your bones to not shift from their position and be in the same position all the time.
Correct.
If there is any injury to the ligament when you play football or when you are playing any other sport like jumping, and these ligaments they break or they tear, in that scenario there will be immense swelling within the knee joint because there will be bleeding. At the same time, the ligaments will themselves cause pain because they are torn or maybe there is a sprain. The first and foremost thing is that you should not walk on that particular leg at all, or for that matter, not use that limb at all once you have the pain. Apply an ice pack immediately. Make sure it is splinted in some way or the other. If you have a pharmacy, you can take a splint from there. If you do not have it, then you can make a, some sort of splint at home and use it. And you should go to the hospital as soon as possible.
Correct.
In the initial stage, when the ligaments are just sprained, or if there is not much tear, then there are high chances that they might, along with the treatment, the medication, the physiotherapy, they might recover very good. But if you continue walking on that, or if you continue using it, or feel that this will get better like any other injury, then you might actually injure it more. So sports injury, they are all recognized, they all come under sports injuries these days. You will have a lot of people who do running and cycling, and also play sports with high intensity like football. These people will mostly encounter some sort of sprain and ligament tears when they are on the field or they are practicing. However, it is utmost importance that they make sure once the injury is big, and if there is a lot of swelling, and if there is a lot of pain because of which they cannot walk, they should immediately go to the hospital and at least get it scanned. And MRI is the best scan to see within the knee joint, and within any other joint for that matter. Get an MRI done. That picture will give the doctor an idea about how much the injury is, and accordingly we can plan, we can formulate a plan as to how it can be recovered. All ligament injuries are possible to be healed in good time. A good example I can give is of Rishabh Pant. He is an Indian cricketer who had a car accident and who had a multiple ligamentous injury in the knee joint. But look at him, he is again playing the World Cup right now. So the recovery has been immense. The technology that we have these days is very good, and it makes sure that the patient rehabilitates faster.
So when we talk about the latest interventions or latest modalities of management of such injuries, what do you like to focus? Because now we are talking about arthroplasty, arthroscopy, and all types of things. So you can give a little information about that also.
So these days, suppose if somebody has the anterior cruciate ligament and posterior cruciate ligament are the two ligaments in the knee joint that are very common, that are commonly torn along with the menisci. So once we do the MRI, we see what part of the ligament is damaged, how much the damage is. Then we plan if the surgery is required for it to be recovery to be faster. We plan accordingly. And then there is a small machine called as arthroscope. Now, arthroscope has got a camera at the end, and this is we go inside the knee joint with a very small keyhole. So we just make a small hole within the knee joint. We take our camera and go inside and visually look at everything that is inside. Once we are sure of the injury, we will take a small graft, again a very small incision, a very small cut on your thigh. We take one of your own tendon, own muscle tendon from there, and then we harvest the graft. We prepare it in such a way that now we can, whatever ligament is torn, we can remove that off, and we can introduce this new ligament within that particular place. Once we are sure, once we look at inside everything and we are sure of the injury, the graft that we have harvested, we'll put it back again in the new place and tie it on both the sides. And for the first 2 days, you will not be allowed to bear any weight on that particular joint. But slowly and eventually, we'll make sure that physiotherapy is started, and within a period of say 2 to 3 weeks, we'll start with most of the things that you used to do for normal functioning. As far as sports injuries and coming back to your athletic activities is concerned, it might take around 3 to 6 months for you to recover better, depending upon what sort of severity of the injury is. But we make sure that you are on the field within 3 to 6 months, in the same manner as you were doing it earlier. Correct. So as far as technology is concerned, it is about the keyhole surgeries, minimal requirement of any blood components for the surgery. These are much more faster. And also we use a tourniquet around so that there is no blood loss. So things are very quick within the OT as far as arthroscopy is concerned. Also, if there is suppose arthritis, as we were talking about, in such a condition, earlier we used to do it, the surgeons used to do it together without using any technology. But now with the advent of new technology, we have this robotic feature coming in. So how does that help the surgeon is that even if there is a millimeter of precision that is required for the joint cut, it will make sure, it will give the surgeon a feedback that we can take a 1 millimeter cut, maybe this side or that side, depending upon which part is more weight bearing. And this is more patient centric.
Acha.
So this will change as per the patient. If one patient requires a particular cut, however, the other patient might have another requirement altogether. So the machine, the robot, it gives you a feedback to the surgeon live during the surgery that we might do a little cut this way, and then the surgeon can execute it that way. So it makes life easier for both the surgeon and the patient, and also has an excellent result. We have been using this technology all the time, and it's really helpful for the patient. Also, it helps to recover faster. Since it is patient centric, it makes sure that the patient is rehabilitated in that particular way and recovers faster.
Achha, so nice of you. See, basically now we are talking about robotic surgery, and those days are gone that everything is to open and all that. So there is no wastage of time, no wastage of, means there is a early recovery, patient feels better. And as you have rightly said, it is, I can say it is point-to-point precision.
Yes.
It is with maybe artificial intelligence or robotic or whatever you have implemented. So a lot of things can happen. And this one good thing is that these are happening in Goa itself. So you don't have to go out of Goa, because we have got a lot of sports people, we have got a lot of sports activity, we have got people playing football, a lot of people at least in Goa, and plus cricket. As you rightly mentioned that one of your cricketer had earlier so many injuries, but by proper surgery and all these events, he has recovered, he's playing back. So doctor, one thing I just wanted, you have mentioned before some time about joint replacement. Is that something called a partial joint replacement, and what is total joint replacement? And what is the difference? And
So-
when you go for that?
Yeah, so very good question. So coming back to your point earlier, which you have said that how we can recognize the problem within the knee joint early, how as a patient we can be more aware. So suppose if a patient comes to the hospital with only pain on one side of the knee, and this is mostly the medial part of the knee joint, because that is the most weight bearing part of the knee joint. If there is arthritis only developed of that particular region, and if we identified earlier on the x-rays, then we can give an option to the patient saying that only this part of the knee needs to be replaced. So you replace only that particular half part of the knee. It is not the complete knee that is replaced. How does that help is, first of all, you get pain-free very fast. Because you have, in the earlier stages, you recognize that I have pain and discomfort. You have come to the doctor, he has replaced your half knee, and now you can come back to your activities. So you are doing it very faster, so that avoids any kind of bowing or, turning of the bones in future. Secondly, because you are replacing only half the knee, most of the kinematics of a normal knee joint, they remain as it is. So a patient doesn't feel as if there is any kind of foreign implant within the knee joint, because of which, there is slight discomfort in the initial region, initial period. Thirdly, the rehabilitation, the physiotherapy process for such kind of surgeries is also very quick. You can start patient on full weight bearing on day 1 of the surgery. You can make sure they start doing stair climbing, sit on the commode chair for all that needs. So this is done faster. Once all these things are done faster, the hospital stay, the rehabilitation cost, and the overall impact on their life is very less, and they can get back on their activities, normal day-to-day activities faster. So I think partial knee is one of the better options.
If you go on at right time,
Yes.
rather than waiting for the total knee
Yes,
replacement.
yes.
So that will rehabilitate. In fact, you can almost work as you were working earlier.
Yes,
Correct.
yes.
So I think going to the doctor at the right time is most important, rather than just going to the pharmacy and buying the tablets or taking on somebody else's head. No, that fellow is taking that, so I am also taking this. Correct. So doctor, one more thing I just wanted to know. Now, since we have talked about sports injury, there are some age-related issues. Like see, in pediatric age group, we have got different type of bone problems. At the middle age, we have almost covered. Now, post-menopausal, I can take, because or older age, because by that time bones are fragile, they are weak, they are quite prone for any trauma and all. So how you'll categorize this and how you'll manage?
So this is a very important issue that we have seen in most of the elderly female population. What happens is, once the menopause, they have menopause, the hormones, they work in a very different way after menopause, and the normal enzymes and hormones that are required for your bones to be formed after menopause, they start decreasing. They go on a decline in female. Now, because of which the bone strength cannot be maintained. So what happens is, if you have seen a bone, there are a lot of structures, X structures within it. These basically are the porosity. As we grow older, especially females, these porosities increases. That means the space between the actual structure decreases. It becomes hollow inside. These bones are, first of all, they can easily mold themselves. They can change in their shape. That is why our shape of the knees and spine can also change a lot. Secondly, even a small trauma, say if you are trying to hold a door at your house and you just slip and you slip and fall down and you can have a big fracture.
Correct.
Either it can be of the spine, it can be of your wrist, which is more common, and also any other joint in the body. This can be prevented. First of all, this is an age-related issue, so this will mostly be there after menopause. So we have to make sure that once you hit menopause, you have regular visit to the orthopedic doctor. Make sure you get your routine investigations done. There is bone marrow density, a test that we can do to just find out how much is the density of the bone. Your doctor might put you on a regular medication, which can be either once a week or twice a week. So not even every day.
Correct.
This medicine can be taken once in the morning. Just they can also put on once a day or once a week or twice a week regime, and then the patients start doing their routine activities as they're doing. Obviously, physiotherapy is encouraged in the patient at that particular age. But once they start taking the medicine, the bone density actually improves. There are a lot of studies that have shown that once you check bone density after starting the medication for 1 year, it can actually improve and they can lead a normal life without any risk of increased fractures. So I would suggest that every female after menopause should ideally be checked for the density, and they should be started on medications because it can improve the overall outlook of the life. Make sure that they do not have irregular fractures, and even if there are fractures because of severe trauma, it will also help that they recover faster than the usual population. So I think it is a very important issue and it should be addressed in the right way.
We are talking about pediatric.
Yes.
So like what we talk about, like green stick fracture and all these things.
Yes.
So what is your take on this?
So pediatric fractures, see, pediatric bones are very soft. So for them to have a fracture, because child keeps on falling every now and then, for them to develop a fracture, the trauma has to be really very severe. Otherwise, they will not develop a fracture. Even if there is a severe trauma, even if there is a fracture, if you go to the doctor at the right time, and even in a plaster, I'm not talking about surgeries at all, even if a normal plaster or support, within a period of 2 to 3 weeks, you will find that the bones have actually started uniting, and they generally unite in the very correct fashion. If you just mold it in the right way, you don't need to get it exactly the same position. Even if you get it in the right position, it will unite perfectly. Now the problem comes when there is a deficiency of vitamin D in the pediatric age group. Most of the people, most of the parents these days come saying that their child has less of vitamin D and they have bone pains. This is because less exposure to the sunlight and also because of nutritional deficiencies. So we can make sure that the child is not deficient of vitamin D, start them on supplement, which can be continued for say 1 to 2 years. And within that period, their entire requirement of the vitamin D and calcium in the body is fulfilled. And they can lead a normal life. So rickets is a challenging issue that has come up. Also, there is scurvy in the bone, in which the bones become extremely soft and they mold in any way. There are a lot of bleedings within the joint that the patient comes with. Again, vitamin C deficiency, once checked, once confirmed, the child can be put on the medications and they can recover extremely well.
Okay. Thank you very much for sharing a lot of information. And as we have rightly started, this is a season which is crucial. So we advise all of you to take care, especially while riding a scooter or two-wheeler. Please wear the helmet. If you are in the car, please wear your seat belt and take necessary precautions and take proper care. With this note, I think, Doctor, thank you very much for sparing your precious time. Namaskar.